Hello and welcome to Differential Discussions. I'm Melissa,
I'm Dave.
and today we're going to be looking at another acute promyelocytic leukemia. However, this one is a microgranular variant.
Microgranular. What does that mean?
So the microgranular variant is where the granules are too small for us to actually see the distinct granule characteristics. So think of promyelocytes usually have really large, beautiful eosinophilic primary granules. They're too small to see with a regular bright light microscope. So we just kind of see the shading of the area if there's enough granules in that location. A
Hmm.
lot of times you don't see anything. And so the granules the cell almost looks like a monocyte.
Yep. And so this can be really challenging. I think one of the other clinical features help out, so the anemia and the thrombocytopenia should make you kind of think and worry about malignancies and stuff. But it might be difficult to kind of nail down what's going on.
Yeah,
Uh,
morphologically, it'll be challenging to know if it's an APL microgranular variant or if it's some kind of monocytic type of leukemia.
yep, agreed. And that's troubling. Well, not troubling, but that's a challenge clinically because APL can be so dangerous at presentation.
Yeah.
So I think we probably talked about this in our other APL video. But generally speaking, coagulopathy and APL are they're in kind. So as these promyelocytes die off and release their granular contents, they stimulate procoagulant activity, and then you have this constant bleeding, clotting, DIC kind of picture. So, and it looks like there might be some schistocytes in this smear, which
Yeah.
is kind of neat. Kind of
Yeah.
shows the intravascular fragmentation that can kind of occur.
Yeah.
So, anyway,
You ready to pop down and look at this one on 100?
yeah, I'm excited to look at the cell. So this white count looks like it's on the lowish side.
It is, which is challenging. So we're
Yes.
gonna do our best to find the cells.
Yep. So I see a basophilic cytoplasm, but there's a little bit of a pink kind of hue to it, isn't there?
Yeah, here and even a little bit right here.
So that's a great clue. Now, I'm monos. Let's talk about monos because that's going to be the relevant thing that you confuse this with. Well, monos are known for having fine azurophilic granules too. So
That's what
that
this
can be a
looks
little,
like.
yes. So I frequently encounter monos that have kind of a purplish sort of kind of cytoplasm color, given the amount of granules and the color of that particular cell. So tricky. I think it's helpful that it's the cytoplasm color in the cell is pinkish, and maybe not being able to see the granules is kind of that hint that it might be a microgranular APL. But even still, this is not an easy distinction, especially for people
Yeah.
learning.
I mean, honestly, the cytoplasm to me has that kind of almost gritty appearance that monos usually do. So I would look at the cytoplasm and think mono.
Yeah.
And then you look at the nucleus and you think,
Yep.
ooh.
So hopefully, yeah. So hopefully, always, isn't it ideal where it's the nuclear morphology that informs the cell call, right? I think the nucleus is just the more important factor. So if we focus there, it looks like we see two hemispheres or two lobes, right?
Yeah.
Um, and monocytes will fold, but they don't necessarily make lobes, though, do they, Melissa? It
Not usually,
depends.
but again,
Yeah.
this cell looks malignant.
Yeah.
It's
Yeah.
just the origin that we're
Yeah.
wondering if it's
Right.
monocytic or promyelocytic.
Mhm.
So could I look at this and think it's an abnormal pro-monocyte? Yep. And it looks like there's a nucleoli here,
Yep.
and it looks like there's another one here.
Mhm. Yep.
Yeah. So when what Dave's getting at is that classic butterfly appearance where you have the two lobes. So if I look around and see that classic appearance in multiple cells, then yeah, I'm probably thinking more APL. But if I'm just seeing this cell alone, then it could be either, because you never know. Monos don't usually do this, but malignant cells don't read the textbook and say, I shouldn't do that. So it might.
That might confuse Dave and Melissa. I'm not gonna. That would be nice if they did that, but they don't.
It would.
So we're gonna look for more butterflies, right? Or the other term I read the other day was coin on coin. You ever heard that description?
Interesting. Yeah.
Coin on coin is kind of a neat way to describe it too. So where we see a Venn diagram of nucleus, sort of.
Yeah.
So that might be a little bit more helpful too in pushing us towards our promyelocytes.
Yeah.
So Melissa now has the painful task of of looking around. Definitely seeing a lot of schistocytes.
Some teardrops.
Some teardrops.
Going in different directions too. So you have like this guy here and that guy there.
So Melissa's pointing out that the teardrops are facing in different directions, so they must be real dacryocytes. They must be real teardrops. So you can see an artifact, I guess is fair to call it, where you have a fake teardrop, but they're typically all facing the same direction. So likely a pressure applied from the smear that made them look like that in that scenario. But these look like genuine dacryocytes. Yeah. They also have nice blunt ends to the drop portion for whatever the
also
words.
Elliptocytic cells.
Yep.
I'm probably gonna have to pop back up and find them.
Yeah, that's not a bad thing to show how we might do this on the bench too. So Melissa's swinging to a lower power objective. So at that point, she can see much more of the smear, and then she can recenter on a newly found cell and then swing back down to oil. Cool. So mononuclear cell looks pretty mature. It's probably a lymph or something. Yeah.
Yeah.
So one of the other cells, when you have like AMLs and stuff, ooh, a neutrophil.
All right, let's swing back up.
Yeah, not uncommon to find lymphs.
Back up. Sorry.
No, that's okay. Don't even worry about the light. I'll just You're gonna be stuck adjusting the light every time.
I know.
So we saw a degree of anemia. We saw thrombocytopenia, and now we're seeing the white count looks quite low. So all things kind of pointing towards a malignancy. That cell we saw had like a bad nucleus, lots of nucleoli. So really the main question we're trying to solve here is
I keep finding all the lymphs.
Yeah, that's okay. You can't really know until you get down. So yeah, another lymphocyte. Not necessarily a bad thing.
I'm not swinging on to 40. The reason is because there's oil in my slide.
So Melissa wants her 40X to work in the future. So she's being careful not to smash it through the oil.
So we found it.
Yeah, we just got new microscopes at school, and I'm afraid to even check what the 40s look like.
These look like lymphies. More cells over here, so I'm just gonna pop back down and
sure,
we'll swing around. Where are you?
Yeah, so I love the red cell morphology on this slide. So if you're undecided, right? So let's just paint a scenario where you know, you don't see very many malignant cells. You're not sure what's what. I would encourage individuals to communicate with the clinical team, get some coag results, right? So we talked about DIC. If we in fact do have a DIC, we'll have a prolonged PT, prolonged PTT, decreased fibrinogen, and a positive D dimer value. So Melissa found another cell.
I did.
What'd you find?
Just the lymph. I stopped because he has granules though.
Cool. So, so something for us to look at. Can lymphocytes have granules?
Mm-hmm.
Darn, this hematology thing, man, is confusing. So yes, we do have large granular lymphs, and they'll look much like that fella. Saw fibrin strands go by. Another lymph. So, ooh, cool. Okay. So the color on this is beautiful, right? So,
Can I put the light up a little bit more?
yep. So I think that this cell can be a bit helpful, right? So I'm not necessarily seeing a crazy pattern in the nucleus, but I do see the colors that are consistent with a promyelocyte.
Mm-hmm. Yep. And again, it has that kind of gritty. It's you don't see the granules distinctly, but you see a kind of a grittiness to it. So it looks like there's granulation.
Mm-hmm. But we're just beyond the power of the resolving power of the microscope, so we can't actually see them as distinct entities.
Yep. And then I'm seeing a nucleoli here and another one there. The nucleus looks a little bit more mature than what a promyelocyte does with the clumping in here, but it still looks like a pro.
And full disclosure, right? So this looks to be a series of slides that Melissa has. And we looked at the presentation day slide, and there's a lot of problems with the smear itself that are outside the yeah. It's just a bad slide. But what might happen once on presentation they discover a person has APL is they're going to give them a very particular drug, aren't they, Melissa? And don't you think that can affect maybe what we're seeing here and the maturity of this particular cell? So in APL, we have a translocation 1517 that sort of inhibits the cell from maturing beyond the promyelocyte stage. And so one of the treatments is to give all trans retinoic acid. So this mutated retinoic acid receptor, we can give a different stereochemical analog that will have better binding to that receptor and allow the cell to mature. And then with the help of the was arsenic trioxide or whatever, with the help of that drug, we can promote an apoptosis and kind of reduce the tumor load. And we might be seeing that here, right? So that might explain why this nucleus looks a little more mature, even though it has some of these malignant features still.
Yeah. And I don't think that we're too far into the treatment in this
Right.
slide because we'd be seeing some really funky looking cells and we're not really
Yeah.
seeing the craziness, thankfully, because those are
Yeah.
terrible to look at. But they could be starting it.
Mm-hmm. Yep. So just a little background, I guess.
And there's no classic butterfly here, it's just an indent.
No. Yeah.
That's
For the
okay.
most, besides the nucleoli, and the
Yep.
shape's a little funky too, right? But besides the nucleoli, overall, the nucleus looks pretty darn normal as far as an APL is concerned.
If you think about the shape too, it has almost more of that horseshoe monocytic shape to the
Mm.
nucleus.
Right? So these are the confusing elements that are fighting each other. The struggles of a low white count and a lymph.
Yeah, but this slide is mostly lymph,
Yep.
abnormal cell,
Yep.
lymph. Ooh.
Ooh, perfect. Perfect. So
Okay.
I love everything about this cell. So I can see a little bit of like a fold there. And then I love the basophilia here,
Oh, wait,
right?
go back to the fold.
Yep. Okay.
So we have the fold, and it's
Yep.
like you have one lobe underneath the other lobe.
Yep.
So you can just kind of see that second lobe just peeking out.
Yep.
And the second lobe is back here.
Yep.
This is that front lobe. And go ahead, next.
And the other thing I'm looking at is the cytoplasm. So there's this deep basophilia that's beautiful, beautiful, beautiful. I would attribute that to reactive lymphs might have a coloration like that, and blast forms will have that kind of deep basophilia. But then I have this beautiful shading of pink that's happening, and even to maybe a lesser extent down over here. So that's showing us where these microgranules are, these promyelocytic granules that are shading the cytoplasm.
And
Really, really
again,
cool.
though, those granules are almost gritty looking.
Yes,
Like
this
you can
texture.
see that there's something there. You just can't see the prominent granules you normally see.
Yep. But yeah, so that's a pretty decent APL cell, I would say.
Yep.
So I may have a little bit more confidence, right? So you're building your confidence on what these cells might be, so little by little, cell by cell,
And then a lymph.
and then a lump.
Normal lymph. He's not a hairy cell or anything interesting.
He's just got some weird blebbies, but he's okay.
Two more lymphs. Another lymph. Oh, yeah, lymphies.
We have a pattern developing here. Ooh. Looks like another APL cell. It's kind of on the smaller side, I think.
No, he's just a lymph.
You think it's a lymph? Yeah.
Yeah.
He's mad.
He's a weird looking lymph. I think honestly, I don't think he's reactive. I think it's just circumstance.
Okay. He looks pretty mad to me. On the
Yeah.
record.
I think it's just where he's touching because the red cells are kind of squishing him into this shape. We're at the edge of the slide.
Yeah.
See? So I don't believe him. I think he's lying. I guess the nice thing about all the lymphs is that folks can see the heterogeneity and the morphology of these normal lymphocytes.
Hmm. That's a glass half full approach.
Yeah, he's kind of destroyed a little bit.
Rare neutrophil. Patient definitely has these low ANC.
How come we're seeing a couple of mature neutrophils if it's I can't get past my pro stage?
I know. Yeah, well, so it is possible that there's still a few hematopoietic stem cells hanging on in the marrow.
Absolutely. All right, let's pop back down. You see? Oh, not yet. I bet people are like, oh, this is annoying.
Well, yeah, I mean,
I agree.
that's what I say on the bench too. This is annoying.
There's a couple of cells here. Let's pop down here. Actually,
Sure.
let's pop down here. That looks like one. Vibrant strands.
Yep.
Not the best area, but
Yep. You got to do what you got to do. So yeah, this looks like I see like lobes, two distinct kind of lobes.
yeah, so it looks like it's coming like up here. And then it almost looks like it goes like this. Little
So
fold.
it's still plausible it's a mono horseshoe. Yeah.
But it's abnormal and it's got nucleoli. And yeah, I think really with microgranular variant, I think the big takeaway is that you really sometimes can't tell morphologically if it is a microgranular promyelocyte or if it's a monocyte. And either way, our job as the laboratorian doing the differential is to identify them as abnormal cells.
Yep.
And then flow cytometry and
Yes.
cytogenetics.
Yes. Yes. Yeah. So I think we do get hung up on, guessing what the lineage might be, but to some extent that's beyond the call, so to speak. If you have relevant clinical information that you can see morphologically, let's report it, right? But sometimes you just got what you got, and it's good enough that you discover that it's a leukemia.
Yeah. All right, well, I think that's all we have for this video, so thanks for watching.
Yeah, thanks for your time. Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video, and feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.